Right, I think we're good to go. Well, thank you everyone, and thank you for joining us tonight for this latest session of the NPA Winter Conference. It's all about being smart with patient interactions and improving your business. Now, there is a lot of things that we do at the moment for the NHS, dispensing the prescriptions and all the services around that. We are going to explore tonight some further opportunities for you all to develop maybe more private services, something that would generate extra income or perhaps maximize what you have already. So if we go on to the first slide, please, Ashley. So yeah, I do apologize. I don't have control of the slides, so you might hear me say next slide a few times. So my name is Olivier Picard. I'm an independent pharmacist. I'm based in Berkshire, for those who know me. I'm also a board of the National Pharmacy Association for the south of England, Hampshire, Dorset, Wiltshire, represent what we call Area 10. And I'm joined with three fabulous organizations tonight. Adele Karan from Real World Analytics, and we are very soon going to find out everything that Adele has to say. Also, Alok Shukla from Instant Dentist, a very innovative service that has been released and launched very recently and going down a real storm and real opportunities for pharmacy. And finally, Zubair Ahmed from MedicSpot. And some of you might have heard of MedicSpot. And again, we will find out what a GP service inside a pharmacy can look like. So why offer private services in your pharmacy? Well, there would be many reasons, but the first one, and I think is the most important when thinking about what we are about to talk tonight, is meeting an unmet local needs. There may be things that you think could happen in your area. People are having difficulty accessing services. We'll talk about those briefly. And I often hear people ask me, will people pay? Well, I'm a believer that if you offer the right service in the right location and it's convenient for patient, then people will certainly pay. It also will help demonstrate your clinical expertise. We all keep talking about that, and yet, if we keep doing what we've always done, then we'll never get anything else. So, demonstrating that you have good clinical expertise will show to the people around you, your patient, but also other healthcare professional, what really you're made of. It obviously enables access to patients to services at a convenient time and location. We all hear about it, we are open longer than GPs, we're more convenient where people live, when people work, and each different location will present different opportunities. And again, I'm hoping that tonight you'll have some answers on that. And then finally, something that's not negligible, with cuts that we've seen in pharmacy, would introducing private services increase some profit into your organization and perhaps complement what the dispensing service that you do now already offer you. So identify new opportunities. Very briefly, what does that look like? Well, it's important to find the right services for your area. I think this is key. I've put a few examples here, but this list is not exhaustive. If you're in a town center, you might want to target people who are working and cannot access their GP, and perhaps something that you'll hear tonight make you think, actually, this is something that applies to you. You could also be in an affluent area where people have young families, people looking to travel. And I know travel restrictions at the moment means that not many people are traveling. But everyone is edging towards travel again, and perhaps now is the time to think about starting a travel service, whether that's vaccination, malaria, and the like. And finally, you could be in a rural area with very little access to, weight loss services, but it could be others. And that's, again, an opportunity of something that you could introduce in your pharmacies. So the main thing is to exploit the gap in the market, because it'll be probably more successful than try and compete with what's already existing. And by all means, you could probably do both, but finding a gap in the market is where you'll make a real difference. And as I say, will people pay? Well, if you offer the right service in the right place, then no doubt people will pay for the convenience. So, on to our first guest. Our first guest has got a wealth of experience, and no doubt she'll tell you all about it, but it's all about market data. Make the most of the data. If you think about it, in community pharmacy, we collect a lot of data, whether that's on your EPOS system or your PMR. But how much of that is really being used? also the NHS makes a huge amount of prescribers' data available. Again, how often do you look at those, and what benefit could you gain from using those in a more effective manner? So real-world analytics as a solution to help you develop your business. They call it the local insight, you know, whether that's on the dispensing side or whether it's on your retail sales side, I think you'll find that the real-world analytics is offering a bit of both, and you might want to tap into that. And then finally, you know, the big bugbear for me, you know, how much are we leaving behind? That could help make things a lot easier. So, without further ado, Adele Kiran, over to you.
Okay, so I just want to introduce myself. I am Adele Curran from Real World Analytics. A lot of the pharmacy industry in the UK have heard of us, hopefully by now. Effectively, what we do is we utilize the data that is available across the pharmacy industry in the UK and Ireland to give real insight reports to pharmacies, whether that's from the public source data from the NHS, where we're looking at your items, your area, your surgeries, or whether it's looking directly into your PMR to see where your risks of loss or challenges might be, or looking at areas for business development around services, etc. So the first thing I'm going to do this evening is we are partnered with the NPA to give a free dashboard to all of the NPA members. And I'm just going to very quickly go through the dashboard first, just to give you an idea of what it looks like and what it's doing. And then I'll just move on and give you a deeper dive into the local insight report. So the pharmacy insight report effectively looks at the latest month's published reports, published data from the NHS. Effectively at the moment we're looking at July, so we're looking at year-on-year growth. If you are part of a group or have a group of pharmacies, we will group those together and look at your individual pharmacy versus your total company. Then we look at the local growth. The local growth is a 5-mile radius from your pharmacy, and depending on whether you're a rural pharmacy or a central pharmacy, so we can stretch that to 10 depending on how far away you are from everything else. And then of course we look at the industry growth. So we're looking at kind of a trend last month, latest 6 months, latest 12 months. Then we look at, okay, well, what's making up those trends? How much of my items are electronic? How much of my my patients are nominated? And again, we're looking at a month-on-month, a 6-month trend against the company, the local area, the industry. And if you've no company, we'll put in the region in there for you so you can look at a total region versus the local area as well. Next slide, please. Then we'll have effectively, so, you know, the biggest impact on your pharmacy is your surgeries. You have to have surgeries giving you items in order for you to either grow your items and dispense them. So having a look at the overall surgeries in the business or in the industry, so how much electronic repeat are the surgeries actually generating, and how much growth are each of the surgeries in the industry getting across the last month, 6 months or 12 months. And then looking at obviously the online pharmacies, it's a good indicator of, you know, making sure that the growth is not all going to our online partners. And then we look straight down to see, okay, well, who is our top surgery? Where does the most amount of our items come from? And then we monitor the trend on that one quite closely, because, you know, a small variance in your top surgery can cost a lot in terms of items, especially if that trend is going towards online. And then we look at the other practices to say, okay, well, here's your top 4 other practices. There's their growth across the month. So you're looking to see, is your growth across each of these months, or the 6 months and 12 months, in line with your top practice or your top 4 practices? And then at the bottom of this one, we're looking then at your services to see how many services you've done, are you above or below average in terms of your local area or the industry? So if you just look at the MURs there, I'm at 249 from last year to April. The company was at 202. The local area is at 182. So I'm above the average. I'm above the industry. Happy days. This year I'm above everyone as well. So I'm going to get my 100 MURs before April. It looks very likely. The local area and the industry are a little bit behind. The NMS, obviously, the NMS is a bigger driver these days because we're looking at now hopefully including more conditions within our NMS remit. We're driving more and more services within our pharmacies, and NMS is a very, very big one, especially as it's a national service. So monitoring and making sure that we're getting the most of our NMS is important. And obviously we had a very big fall off with NMS around all the lockdowns and COVID. We saw a lot of growth across our customers on the way back up from about July to now. So we're expecting that people are taking the challenge and moving forward with the NMS. So then from here, what I'd like to do is just give you an idea of what a bigger report looks like in terms of a real world analytics report. This specific one is looking again just at the NHS data. It's the public data. So here we're basically looking at the summary from the front page. We're basically breaking that down into much more detail so you can see exactly what's going on. So here we're looking at, these are the top 10 pharmacies within my local area. You can see I'm the purple one, I'm number 1. And the circles generally change size depending on how much items each of those pharmacies are doing. If I move down to the next page, this then breaks down each of those pharmacies, basically says, these are your competitors. These are how they are doing. So effectively what we're doing is we're taking the noise away from putting these reports together. We've done it, we've basically looked and worked with the industry leaders to put these reports together so you get the best information directly into your email. There's no logging on, there's no creating reports yourself. You get this emailed directly to you on a monthly basis, and it gives you basically everything that's going on outside the door of your pharmacy. So the next page then is breaking down the items and the EPS just into a kind of a trend line, so you can see yourself versus the rest of your neighbours, to make sure that your kind of trends are either above average or at least in line with the local area. We don't want to be looking at trends where we're falling. The next slide then is giving us a breakdown of the pharmacies. So what this is doing is basically saying, these are my surgeries. These are my top surgeries, and these are the other pharmacies that they are sending items to. So what we're monitoring here is effectively the green and the red. It jumps out at you. You can look at it and say, oh, great, I'm number 1 here. I've got 16% growth, 24% in the last 3 months. I know Swan Surgery is up 17% based on the last report that I looked at. So I'm moving along with and alongside the pharmacy. Then I'm looking at, oh, well, Boots is definitely losing items there. So maybe I'm getting the Boots items as well as the surgery growth. So what we don't want to see is that our pharmacy is losing items. But if we do see that our pharmacy is losing items, we know who we need to talk to. So we know, do we need to talk to the surgery about them sending items to the online pharmacy, and maybe we need to come up with a plan to maybe move more patients to electronic repeat so that there are less risk of transferring nominations around. Do we need to do more deliveries? Do we need to work and develop more services to keep these patients with us? But if your surgeries are increasing their items and you're not increasing with them, this particular report gives you a very, very quick snapshot. As I said, the red and green jumps out at you exactly what you need to do and who you need to talk to. So the next page then, this is saying these are the items. So if you have a look at this, these are the surgeries, and in the middle of this, the purple dot is us. So we can effectively see straight away who's the nearest surgery. Next slide, please. And this is the breakdown then of those surgeries. So we're looking at the items of the surgeries, their growth, and what our percentage share of is of each of these surgeries. And then we look at them themselves, so how much EPS is that surgery doing? How much repeat is that surgery doing? What's their rolling yield and what's their growth? So these are the bread and butter that are coming into your pharmacy every day, and they're the ones you need to keep monitoring. Next slide, please. Okay, so then here's the important one that we're kind of focusing on today is services. So, when the NHS are publishing public data, they publish the national services data, which is at the moment just MURs, NMS, and flu. And also currently the COVID deliveries are being published. So we're effectively looking here to see again, these are the other pharmacies in our local area. What we see a lot is that people say, I can't do NMS because I don't have the patients in the area that need NMS. But if you look at the surrounding surgeries or the surrounding pharmacies, you'll know straight away that there is the patients there to do the NMS. If my Lloyd's in Unit 4 is able to do 9 and I'm only able to do 4, maybe it's because I'm Xing out of my screen rather than actually processing it for a NMS. So what we're looking at here is a more detailed report of the dashboard that we're going to be sending to all of NPA customers from the beginning of December. Some of the NPA members are already getting it, but everyone else should have it by the end of December. Now, effectively, you can look at this and go, well, this is the past. The past is still a very good indicator of how things are going to go forward. Another service that we do offer is our PMR service, and that effectively allows us to look at the data on your PMR and give you indicators of more business operational issues like expiring scripts, like exemption issues, like emerging prescriptions, like medicines being written as a generic and being dispensed as a brand. And also along the lines of when we're focusing on the services, who are our patients that are relevant for specific services? So by looking at the data that you've got within the PMR, which is a vast amount of data, it's humongous, the amount of data in it, and it is daunting, it is very overwhelming. But utilizing a system or a BI system like ours or like somebody else's allows you to cut through the noise and get to what exactly you want to see. So if I wanted to look and say, okay, well, I want to refer some patients for this new dental service that I'm going to do. Okay, well, now let's have a look at what type of patients do I have that might need a dental referral. So you already have that data in your PMR. You know that a diabetic patient is likely to probably have issues with their teeth. Maybe I look at my diabetic patients and suggest to them that they might be interested in a referral for a different service. You know, if I have a service for I'm thinking of the word, but I can't think of it in my head. For, you know, if you're looking at people's feet or, you know, other different services like paid services, you can say, okay, again, or, you know, people with asthma suffer with their mouths as well. So referring and knowing these type of conditions, which is already ingrained within your PMR, will allow you to drive more services within your pharmacy, whether it be private services or whether it be public services, whether it be local commission services. All the data is there for you. And as I said, I understand it's a very daunting and overwhelming amount of data that is available to pharmacy in the UK. But if you utilize a service like ours, you should be able to really develop your business, plug all the leaks where you might have them, and in a lot of cases the leaks aren't there too often anymore, but it's all about the development of your business and ensuring that you're keeping up with the next set of requirements that the NHS wants of pharmacy in the UK. Okay, sorry, I think next slide. Yep, that is me done. Thank you very much.
Adele, thank you very much for this. I mean, obviously, the thing that I'd like to pick up on straight away here is that the fact that as of the 1st of December, you have told us that the NPA members will have access to a free dashboard. And some of you may remember the use of Check 34 in the past. And I think looking at this, it sounds very exciting. And I think something that that NPA members will be able to use freely as part of their membership. So thank you very much for that. Now, we've had a couple of questions, but I would like to go on with the presentations for now.
Okay.
And then we'll come back to the questions at the end, and we'll group them for you depending on who they are for. But thank you very much, Adele. So on to our next guest speaker. If we can perhaps go back up a slide, please. Ashley, there we are. So MedicSpot, and Zubair from MedicSpot is going to explain perhaps something that's not necessarily the latest service out there, but certainly one of the key one that pharmacy could make use of. When I looked into this, and when I looked at the presentation, I thought to myself, why aren't we all doing this? If you can go back a slide again. Oh, thank you. I'm not sure. So what is MedicSpot? In short, MedicSpot is the opportunity for pharmacists to offer a unique service. It's a convenient private GP consultation. People can pre-book, people can walk in, and no doubt Zubair will tell us all about how this works. But the other opportunity that it offers is the opportunity for you to start having sort of private prescriptions that can trickle down through the system. Your patient being able to get a referral letter, all this from your pharmacy. It uses technology. You will have the opportunity of having a telemedicine consultation station installed in your consulting room. It is fully managed. It is encrypted end to end. It's completely secure. And MedicSpot is really looking forward to working with pharmacies like you and I, dispensing prescription, attracting extra footfall, and potentially increasing sales, because we all know that the GPs are likely to not only prescribe things but recommend self-care medicine. So I really look forward to this presentation. And Zubair, if I can ask you, over to you, please.
Thank you, Olivier. Next slide, please. Next slide. Yep. As Olivia said, my name's Zubair Ahmed. I'm a GP by background and co-founder and CEO of MedicSpot. And I started MedicSpot about 4 years ago, really to bring pharmacists into the front line of healthcare. I knew as a GP how many patients came in to see me in my GP practice. I was thinking, hang on, most of these could be done from a station which looks like this, from within a pharmacy. Next slide. So, of course, there's been a lot of telemedicine and digital healthcare innovation happening over the last couple of years, more so over the last 9 months, of course, due to the pandemic. But just at the start of this year, 11 million patients waited more than 3 weeks to see their own GP. So, if you look at the private side, this presents a large opportunity in order to provide private healthcare services, GP services, to the patient population. Next slide, please. So, like I said, there's been a lot of innovation happening in this. So many companies, many apps and video consultations and Skype doctors. However, as a clinician, I know, and many of you being clinicians also know, that most of the time you're making a diagnosis, you need to do some type of visual or physical examination on the patient. Next slide. So we developed something called the MedicSpot Clinical Station, as you can see here on the right-hand side, which is essentially our platform, software and hardware platform, which allows a real-time two-way communication, a video consultation to be performed between the doctor and the patient. So the patient will sit in front of this machine, the doctor will ask questions, and the doctor will ask the patient to manipulate the stethoscope on the chest. Breathe in, breathe out, put the otoscope in the ear, put your arm in the blood pressure cuff, etc. So all of this diagnostic and examination data is transferred from your pharmacy consulting room to where the doctor is. So essentially, it can turn any small room with Wi-Fi or an internet connection into a mini GP clinic, which can treat 70% of all cases. Next slide, please. Yep. So we've done some research back in the early days, and we felt through this technology, 70% of all GP consultations with this technology can now be done from your pharmacy consulting room. So of course, private consultations is just the start, but we're working with some NHS organisations as well on driving NHS traffic into pharmacies which have medic spot stations. Next slide. So on just going back to the private side a little bit just now, the patient journey is very simple. A patient can go to our website, book an appointment at your pharmacy, make payment of £49, and then they're sent a confirmation. They go to the pharmacy. When they go to the pharmacy, they go into the consulting room to have a consultation with the doctor. The average consultation length is about 12 minutes. And most consultations result in an electronic prescription being generated. So our doctors do a prescription which automatically is sent to the pharmacy the patient is at, and the patient can leave, go to the dispensary, pay for the private prescription, and go back home. So for the patient, this is unrivaled. The patient can go into a pharmacy, get a consultation, get an examination, and get a prescription all within 20 minutes, rather than waiting, hours, days, or weeks to get a traditional NHS GP appointment. Next slide, please. So generally, patients find out about your service through two ways. We do a lot of digital marketing for each pharmacy. So you can go to our website, you can go on Google, you can see we have our own in-house marketing team whose sole job is to increase the exposure of your pharmacy and your medic spot clinic. But more up to this topic we're talking about today is linking your walk-in traffic to further sales. So if you think about a patient coming in who might have a bit of sore throat, it's not getting better for 2 weeks, likelihood they need to see a GP. So you can offer that service straight away. Similarly, for things like acne, for instance, if over-the-counter treatments haven't been working for this patient, perhaps they need some antibiotics, or if they're a female, contraceptive pill. So we can link a lot of medic spot services, private GP services, to over-the-counter sales. And I think that's a really good opportunity for pharmacies. Our best pharmacies do this really, really well, and they're getting a really good following in the local community. Next slide, please. So in terms of patients per month, as you can see from this graph, from the time the medic spot station is installed in your pharmacy, on average, the average monthly growth rate is about 8.4% per month. So the longer you have the medic spot in for, of course, like any service, the more patients you see. And of course, this is the average. Some are worse, some are a lot better. Next slide. Generally, the pharmacy generates revenue through two ways. First of all, for each consultation, the pharmacy gets £5 revenue share from the consultation. And in addition to this, they also make about roughly £10 gross margin per consultation through the prescriptions. Next slide. So the process for setup is very simple. We get in touch with us. We'll have someone contact you. We can sign a contract. We do a quality check at the pharmacy, make sure the consulting room is up to a standard, make sure there's good internet connectivity in it. One of our installers comes and installs the station, provides you with all the training material, all the SOPs, and we train your staff as well. And then that's when our marketing machine kicks in to try and generate more footfall for your pharmacies. All this process can take up to 2 weeks. Of course, with COVID, it can maybe take a bit longer sometimes. So we're offering our MedicSpot. Our aim is to get as many of these stations out there as possible. So we're not charging NPA members for this station. We really want to see a MedicSpot in every single pharmacy at some point, either for private side or the NHS side, which we're making quite good traction in. Next slide. So give us an email at pharmacy@medicspot.co.uk if you're interested, and we'll have someone reach out to you. Thank you.
Thank you very much, Zubair. I mean, I thought this would be a headline grabber. I wasn't wrong, was I? This is really exciting. Free to NPA member. That was going to be one of my questions to you. How much does it cost? It costs nothing. I mean, if you have the space, it is a no-brainer in my opinion. So I'm really excited. Two things I'd like to pick up on. The first one is 11 million patients are waiting 3 weeks or more to see a GP. I'm sorry, I'm looking at my notes because I just wanted to make sure that I had the right number. That's a huge amount of people. And 7 million people per year are advised to see their GP by a pharmacist. Now, if you can convert a fraction of that into your MedicSpot consultation, you could be on for a real winner. So again, we've got a couple of questions come through, but I'd like to push those to the end. If we go on to the next slide, please. Thank you. So our third presentation by Alok Shukla is about instant dentist. Now, perhaps less of you have heard of instant dentist, but I don't know if anyone's tried to get an appointment for themselves or their children with a dentist in the last 6 months. It has been almost impossible. Dentists have been put in a position where they could not work. So this is actually, I think, an equally huge opportunity. Digital dentist screening from your pharmacy, and my understanding it's not just from your pharmacy, and hopefully we'll hear a bit more about that. But to help you understand a bit more, 50% of adults and children cannot access a dentist at all, and 90% of adults have untreated dental disease. Now, how many of those come in and ask for advice about sore gums, sore teeth, dental pain, and so on? And how many of those will benefit from this service, as well as increase retail sales? Instant dentist will help, similarly to others, increase your customer base. If people know you have the service in the pharmacy or know that they can use it through your pharmacy, then they will. Similarly to MedicSpot, you'll be able to dispense by prescription as and when they are issued. And finally, you will have no doubt potential to increase your knowledge and possibly your sales of oral health products. So, again, really looking forward to hearing what you have to say, Alok. Try and squeeze it in 10 minutes so we've got time for some questions at the end. Over to you, please.
Perfect. Thank you very much. I'm just going to share my screen now. Okay, great. Perfect. You can see my screen okay now. So my name's Alok. I'm co-founder of Uplift Health, and we've been working in teledentistry since 2015. Our whole vision is to make dental health essentially democratized, make it affordable and accessible. And through Instant Dentist, that's where we're working with pharmacies, and we're really excited to talk to you about how we can do that together. So our whole vision is to make it super simple, super easy for everyone to access professional dental advice. As Olivia said, 90% of adults have untreated dental disease. Pre-COVID, 7,500 people a week were going to their GP, not their dentist, for dental problems. There's many things. People are scared, people don't trust, and ultimately it's expensive. The thing is, most conditions, if detected early in the reversible phase, can be prevented. And you guys sell all the products to reverse these things. Durafat toothpaste, chlorhexidine. With the right screening and assessment, lots of opportunities can take place. Essentially, what we've been kind of all talking to together is your next level of pharmacy. It's turning your pharmacy into a digital health and wellness hub. You've obviously got the GP services, men's wellness, children's wellness. And what I'd like to talk to you about is introducing dental wellness as a natural adjunct, because then you can help educate all of your customers about all the different services you can offer. And it can start from dental health screening and emergencies for the people that can't access it. But I'm also going to touch on how that can lead to additional sales of teeth whitening and straightening, which are higher margin as well, potentially. So every day you have people coming into your pharmacy looking for specialist toothpaste, looking for specialist mouthwash, and people are used to buying what they require. And if there is a better product and they understand the reason for that, most people would do that because nobody wants dental treatment. What we do with Instant Dentist is provide a kit and digital assets you can use on HealthPoint TV screens or posters and also on products to install. It's free. And what we're doing is we're leveraging where people are already looking for oral health products to convey the message that if it's been a while since you've seen a dentist, you can access a digital dentist now. So how does that work? So the whole system is asynchronous. There's no video call needed, and they can use their own mobile device, so it's quite clean and hygienic in that way. There's two types of consultations someone could do. A specific concern, which tends to be the kind of emergency, wisdom tooth problem, bleeding gums, patch on the tongue, all these sorts of things. Or it could be I want a dental health assessment. Again, that's where we go through a comprehensive health screen. They can do the assessment, they can securely message the dentist, and they get professional advice. And then if there's a prescription required, we can send it digitally straight to your pharmacy and to the person. It's priced at £20, less than an NHS checkup, and we create a code for your pharmacy so the person saves £2 and then they have a motive to use it and we can identify your pharmacy. So here's a little bit of an interface. They just start clicking and answering questions. They don't need to download anything special. It can literally get started within a few seconds. And from this, they're able to clarify what history and issues they've had in the past, and also what some of their motivations are moving forward. So we can start to understand, do people from your pharmacy more interested in improving their smile, which most people will pay for, or it's more about intermittent pain management. From the photos and video, it all goes into the system. They would then put in the code, which is unique for your pharmacy, and then they would receive on the same day a comprehensive report explaining all what's going on. And then from that, they can understand the issues and what products they would need to get. They will all need to buy preventive products. And so there's a great opportunity to put together what we call condition packs, where, for example, for a wisdom tooth problem or for a gum problem, there are recommendations we can say for you that you can put together. So in the report, for example, in a comprehensive dental assessment, they get risk scored across biology, structure and function, position, color and shape, and then they also get annotated information about specific areas. So for example, if we look at this bottom tooth, it's actually the very bottom one with a little black square on it. And what happens is when you've got early decay in the enamel of your tooth, which is about 1.5 millimeters thick, it can actually be reversed. So if you have like a higher fluoride intake and reduce your sugar, so that's where Durafat comes in, cleaning more effectively, all these sorts of things. So again, people will be highly motivated to get the right products from you guys to not have it drilled. I mean, no one wants that. There's also lots of people worried about soft tissue problems. If you've got a patch on your tongue or something, Google is not your friend. You start searching that, you're going to get scared very quickly. And also the thing is, you need to be able to track these things over time. So with this, you're able to track and see what's going on and get professional advice. And then if you require a prescription or further monitoring, again, all of this is stored in your digital dental record. So that's what's created at the same time. And then you've got the more classics where they have the emergency, where someone's lost something. And then obviously you can sell a temporary filling kit, but the person can also get advice on what would be appropriate. So that's the kind of basic level. And as I say, it's free to install to enable dental health access and emergencies. There are additional things that people could then access from there, because the whole point is to make it affordable and accessible for people to access professional services. So there are other opportunities to sell, for example, professional teeth whitening comes from prescription, or teeth grinding splints. And even we have cosmetic teeth straightening with invisible aligners. That's where they would essentially buy an impression kit, a smile box from your pharmacy, and then they're able to have their teeth straightened and monitored remotely. We have customers in 60 countries over the last 4 years, and this is actually growing very quickly. It's one of the most requested procedures. It's a third of the cost of in-clinic. So again, what we're trying to do is help pharmacies unlock new opportunities. And just to finish, the model that we've been showing you requires nothing to be installed apart from, takes 15 minutes from a pack. But we've got a new piece of technology called a dental scope, which we'll be making available to NPA members later on that want to, that they could sit alongside their medic spot station in the consult room to offer enhanced consultations. We're now working with Bupa, for example, who will actually pay for the consultations. So we're trying to work with more employee benefit companies and things like this to drive more people so they can access these services. So you can see a little bit of an idea of how this works. So when someone has a worry about maybe something at the back of the mouth or in a difficult to reach area, with this smart camera, which can be placed in your consult room, it enables them to upload and record very detailed views of video, photo, and then they have this to be able to track their health over time. For children who are nervous, many times children are taken to a dentist, they don't open their mouth. For people that can't access or travel to places, it's a really great way for them to understand what's going on. Plus, anyone that's looking here will see they need the small brushes, maybe an irrigator, all these sorts of things from your pharmacy. So it's a helpful way to help people understand more about their health, cross-sell other digital health solutions like MedicSpot, and sell more preventive oral care products, basically. But no, it's great to talk with all you guys, and thank you for your time.
Oh, thank you very much. I mean, that is fascinating. I just want to pick up on something you said here. You said Google isn't my friend. Can I just say, it might not be my friend, but it's a friend of most of my customers. The number of times that I have people come to see me and say, I've Googled my rash, my spots, my problem. It's worrying and in a way fascinating, but I think it's the reality. It's the reality that most of the patients that we see will Google things, especially in the absence of seeing someone. And I think with what you've just said there, it possibly makes the access to dental advice much quicker, much swifter, and by the sound of it, cheaper than seeing a dentist. So initially it's great. Perhaps before I go on to the next bit, I just want to ask you a question there. What happened if a patient needs a treatment? Can they then be referred to an actual dentist?
Yeah, great question. So in the report that they get, it's written what elements can be kind of prevented or intercepted with products, but then it's also highlighted what treatments you may require from a dentist. At this point in time, we're not saying go to particular dentists, but over time, what we want to do is develop relationships through the pharmacies in different areas where it can help you guys build relationships with other clinics that can refer to you more. And in turn, you're able to kind of send patients to them as well, right? So it helps create almost like a digital primary care layer in that over time.
Thank you. Excellent. Well, thank you, guys. Thank you all of you three. We're going to go into some questions, but before we do that, I just put a slide in the presentation here to highlight other services that are available to NPA members. And you've got them here. I'm not going to read them. From credit card terminals to signage to setting up your own travel clinic. So some real opportunities to save money, but also to develop new services if you're not already doing them. I mean, what I've heard here makes me want to phone you all tomorrow morning and say, can I please have an appointment straight away? Because I want to explore this further. But certainly there are other things from printing services, as I said, to a lot of more that the NPA is doing. So visit the NPA and webpage and check for those. And if you have any questions, please ask in a question button. And if we don't have the answer straight away, we'll come back to you. If you can go to the next slide, please. So, a little bit of a summary here. Before starting a new service, whether this is one of the three that you've just heard or another that you have in mind, you need to check who else is offering the service. And that includes not just pharmacies. I mean, obviously, we've just heard about, the data that's available from the NHS, what doctors can do, what dentist joint venture we can have, and so on. So these are excellent opportunities for you, but you need to check what's available already. Offering new services will no doubt attract new customers. I mean, the graph that we saw here from MedicSpot as to the number of consultations that increases by 8% a month. If we're in it for a year or two, you could be really busy with that. I wonder whether you might need a second consulting room, but that's perhaps a question that I've seen floating about, which will pop out to you later. And the other thing is, when you're one-to-one with your patient, what better opportunity but to promote other services? If you're talking to someone through an MUR, an NMS, or anything else, can you identify something that perhaps could be referred to one of those private services? Pharmacist feels under pressure to match or better prices, and that That's not on something like MedicSpot or Instant Dentist where the price is fixed for you, but more on other services that you might do. So whatever you decide to do, if you go low to try and be attractive, bearing in mind that it's easy to be low, it's much harder to increase the price later. I hate when I hear people race each other to the bottom by being the cheapest possible, because ultimately you're offering a clinical service and you don't want to overwork for nothing. So please bear that in mind. And whilst the price is free or the price is not set, sorry, you can't do everything for free. If we go on to the next slide, please. So make time to start simple. If you are struggling already to find time to undertake many services, perhaps picking a service that you think you can do well is a good start. Because if you start one, your team will adapt, and perhaps developing your team will lead to developing further services. So my advice always is to start with one service, do it well, and add more later, rather than try and rush and do everything at once. And obviously, the more services you undertake, the more cost effective they become. Also, the more easier they become, or the easiest they become to deliver. And I think it is fair to say that those that do most services tend to be the one that have the highest footfall. So bear that in mind, step by step, but we want to get there. Next slide, please. And then in conclusion, and to finish this before we go on to the questions and answers, think about the obvious way to start a service. Most of us doing flu vaccination at the moment. Why not use your vaccination skills to start a travel service if you're not already done so? If you're doing allergy testing, why not delivering a celiac testing service, to complement that, because you already have the network and the kits to do that. Could you offer more services if you're already offering a diabetes testing service? Could you offer more services that includes the technique of checking a blood sugar? Again, whatever you decide to do, speak to colleagues. People can message me. If you're in my area, you can contact me via the NPA. You can contact your colleagues. There will be support out there. And if you turn to organizations like the NPA, we have partners and services ready to roll out for you to help you, take you through the first steps. And then once you get going, I have no doubt that you'll enjoy delivering those services. Next slide, please. Now, on to questions. So we've had a couple of questions, and if you bear with me once I look at the screen there, we had a question which I think is for Adele. If I may, Adele, if you can come back.
Yep.
There is a question about where on the web can I compare service provision and see my own service provision that I do for the NHS. So obviously you get your information from somewhere. The question, I think, probably from Dave is about where can I view that myself on the internet?
If you go on to the NHS website itself, the NHS BSA, there is a platform there to allow you to download data. Now, there's a lot of data there to download, and it is, as I said, a little bit daunting when you get to see it. But the data is all available within their website.
And is this something that we could share with the people listening tonight? Maybe not tonight, but is it something that we can share with them?
Yeah, absolutely. I can definitely find the link directly for the services if that's what you're looking for, and I can share it. Yeah, no problem.
Yeah, I think that was really the question. So if we get this and get the guys at the NPA to circulate that to the people that registered to the webinar, yeah. I think that would be helpful.
Yeah. So I suppose one of the things that you'll see when you go onto the NHS website is that they give you the information by month. And then, you kind of need to put it together, which is something that, a company like ourselves already do for you. So we basically sum it all up for you and present it to you in a kind of a legible fashion. But the raw data is all there directly from the NHS. So yeah, no problem.
I'll just put it out there. I have no intention of going to dig for that data myself. But
well, I can send you the link, no problem.
It's just because a question was asked. I think I would have too little time to engage with such activity. I have a question regarding MedicSpot. Can the consultation room be used by the normal pharmacy activity, or do I have to have a separate consulting room for the MedicSpot kit and consultation?
No, you don't require another consulting room. One consulting room per pharmacy will do the trick. In fact, our busiest pharmacies only have one consulting room, and they're thinking about building a second one just for MedicSpot, but it works fine with just one.
And if I go on from there, if I use my consulting room to deliver my own services, and suddenly someone walks in with an appointment, how do I know someone's coming?
So when a patient books an appointment online, we get in touch with the pharmacy saying a patient's coming in tomorrow at 3 p.m. Is that okay? And if it's okay, 95% of the time it is. If it's not okay, we get back in touch with the patient to rearrange the appointment.
And how do you get in touch with the pharmacies?
So we do two ways. First of all, we email, and if we don't have a response, it's just an email with a button on it. Yes, it's okay. No, it's not okay. If we don't get a response within a few hours, we pick up the phone and phone the pharmacy.
Thank you. There's been a question again regarding the equipment. We are in the middle of a pandemic where we need to clean everything. Do you come out and clean the equipment every night?
The pharmacy is responsible for cleaning equipment after every consultation. So this hasn't really changed with the pandemic. Ever since we started, it needs to be cleaned after every consultation. It takes about 1.5 to 2 minutes to clean it, and it's just the way it is. It's just what we have to do. And when the pandemic hit, of course, we got it retested again with our cleaning measures, and it passed. So it's our cleaning SOP is COVID safe.
And does any of the equipment needs to be calibrated?
Yes. So the equipment needs to be calibrated yearly, and we do that. So we provide a full end-to-end service. So we come out and calibrate it, or most of the time we send a new station out and get the old one back.
Thank you for that. I might come back to you in a minute, but I want to ask Alok a couple of questions that have come through. How often do patients visit community pharmacy for dental problems?
I read somewhere that between 2 to 3% of traffic coming in has some form of dental problem. It may not be expressed always, but people may be buying painkillers or different problems. And I think this is where the opportunity is to be having conversations about what's the issue and using signage to prompt other discoveries.
So you mentioned advertising the services through my television in my window. Well, can I just tell you, I don't have a television hanging from the ceiling in my window. What other material do I have to promote this? I mean, my patient don't want leaflets. It's not COVID friendly. Oh. How do I promote this, and what do you offer support wise for pharmacies?
Sure. So if you have a HealthPoint TV, great. You can have an animated, video that would go there. But what we actually provide is point of sale material for your shelf. So what that does is it just fixes to your shelf, and it has prompts about the service and what's going on. And we provide stickers which are branded with your code. So each pharmacy has a discount code, and that then goes on all the oral health products. So again, this can drive consultations even after people leave your pharmacy, and you still get that revenue.
Okay, and a similar question to the one I asked Zubair about cleaning the equipment, because the question came from one of the person watching, and how that little probe that you showed us on your little video there, how does that get clean? I mean, obviously we're not talking here about a wipe over something. Surely it's got to be a bit more thorough.
A great question. So yeah, for the dental scope, what it does is it comes with disposable plastic sleeves. So then each one has like a different cover which can be changed. And then it's also the standard SOP of disinfecting and wiping it afterwards, essentially. But just to reiterate, you don't have to have that to install the solution in your pharmacy. You can use the model which uses the patient's own mobile device, and that can be implemented. And then if you wish to, you could offer enhanced consultations.
And tell me, because maybe I missed it in your presentation, I understand there is a code and there's a discount for the patient, but what's in it for me? I mean, the people listening tonight, they are not going to start something, if it's not going to add value to their business one way or another. And we're looking at more than one way of increasing, whether this is through loyalty with patient, increased sales, prescriptions. What's in it for me?
No, very simply, every time someone does a consultation, you receive a payment. And at the same time, also where there's a private prescription, you can then charge as you wish to. And then the other thing is you should use this to drive increased oral health product revenue as well, because as I say, these people are then engaged and they can buy additional products and packs from you. And then if you wanted to, there's the additional services which could be sold, such as like from the teeth straightening and stuff. And all of those offer additional revenue opportunities as well.
Thank you. That's great. Now, remind me, how much does it cost to sign up?
It's free for NPA.
I thought you would say that. Zubair, how much is it to sign up to MedicSpot?
It's free.
Oh dear, oh dear. I've got something going now. I just want to go back to Adele, if I may, please. How do pharmacist owners define the data that will make the difference to their business, and how do they utilize that data to make changes to their businesses? So, you've produced reports, but how do I define what's important data and how do I use it?
I suppose a pharmacy is a very data rich, and I suppose what you're utilizing when you use a BI solution like ours is industry expertise in the directions that you need to. So when we look at a pharmacy's business, so we would analyze the data for the pharmacy and look at all of the key areas that we have developed and built with other pharmacy industry leaders in England and the UK. So we effectively identified already what the key areas are, and we pick them up directly from an extract from your PMR, and we focus the pharmacy on where the important areas are, whether that is loss areas, whether it's business development, whether it's services, but we utilize the data for you to give you the direction that you need. Because the hardest part about starting a data journey is actually starting. And because we have already started and we're a long way down the road, we're helping the pharmacies to identify the areas where they need to look at straight away.
So forgive me for saying this, but I might speak for many of my colleagues here, but I am data rich, but time poor, really time poor.
Yeah.
How much time is involved in this? Do I have a one-to-one? Do you come to my pharmacy and talk to me on a regular basis? Do we have a Zoom catch-up? How does it work?
Yes. So effectively, about probably 80% of the offering that we do for the pharmacy is sent directly to the pharmacy in terms of reports that we have already identified the areas. We know exactly where your areas of pain are. We know exactly what areas you want to develop, and we create those reports for you and send them directly to your pharmacy. So we're doing that for you as part of our onboarding process. Our customer success team are highly embedded in every single one of our customers. So we benchmark all of our customers every single month against each other. We know exactly what good looks like. We know exactly what needs to be improved looks like. And we speak to our customers every month in relation to the areas that we think need further development. As part of like a year one process, we would speak to our customers probably within the first 3 months, every fortnight, and then after that, every month. And again, it's a Zoom call now, where we used to be in the pharmacies or in the pharmacy with the owners, but now we do it online, which actually is very more time effective for everybody. We get in there, we do half an hour at a time, focus on a specific area, and then move on.
Thank you. And remind me, how do I get hold of you? Do I contact the NPA and they signpost me onto you, or have we got your direct contact?
Yes, so as we're partners with the NPA, yet they have our contact details, so you can contact them directly, and they will forward you on to us.
Thank you very much. Listen, guys, I think we're getting to the end. I think we've answered pretty much all the questions that had been asked. I had made a couple of notes. It seems that NPA members are getting a lot of free stuff here if we're willing to engage with these new partners. I think it's really exciting times. And when I hear a pharmacist, not necessarily complaining, but looking at their profit and loss and thinking, where can I improve this? I'd like to think that tonight what we have presented for you, whether that's how to use my data to maximize my income, or introducing new services such as private GP and private dental services in your pharmacies, I think it's really exciting. I was given until just after 7 o'clock. It's 3 minutes past 7. So I think I would like to thank our guests tonight, Adele, Zubair, and Alok, for your good timekeeping, your excellent presentation. I've really enjoyed having conversation with you. I hope the pharmacists that joined us also enjoyed it. And if I can, just before we leave, go on to our next session, which will start at 7:30, about providing pharmacy services at a distance, including via the internet. That is you talking to your patient at a distance. Then you absolutely need to tune in at 7:30 this evening on the next webinar for the NPA conference this autumn. Thank you very much, and goodbye all.